Hello, my name is Sophia Simbana, and I'm going to talk about my presentation of causes of anxiety and depression in adolescence. So, the biggest thing that I wanted to emphasize is understanding our students is necessary to support our students. And how I'm going to support that is through what we'll cover. So, I wanted to talk about data, the populations, I want to talk about causes, I want to talk about symptoms, I want to talk about how schools already address anxiety and depression in schools and how it can be better, and what we can do for students as teachers. So, at this first graph, we have the populations of adolescents affected by anxiety and depression, and it's split up by female and male. And then also LGBT and non LGBT. You can kind of see the differences there and who's really affected. I have a quote here. Depression, anxiety are among the leading causes of illness and disability among adolescents. And that's about 1 in 7, 14%, 10 to 19-year-olds that experience mental health conditions, yet these remain largely unrecognized and untreated. So it's a problem. So to get into the causes, they're very, anything can really cause anxiety and depression, but these are some things that we definitely see. Some things like genetics, there's some things like trauma where, students may be getting abused at home, they may be having violence, they may have been involved in an accident. Environment, which is also so vague. Um, School, home life, social life. So, you never know what's going on at home for students. You never know what's going on in their social life. There could be, one of the biggest things is poverty for students. There's so much unnecessary stress that is added on to them that they have to deal with, which in turn causes anxiety and depression. There's substance misuse, which is sometimes such a circular issue because sometimes students are often introduced to that, especially in high school, but then they're self-medicating, and then because they're self-medicating, they don't feel good, but they want to do it because it makes them feel better, they think, so it's just a circular issue. There's also things like differences in the brain. Developmentally, students are not adults. Our students' brains are not adults. Um, and they're going through changes where their brains are sending different signals and it's really affecting their mood and their behaviors. There's also kind of along with that is stresses of puberty. It's kind of similar. Their hormonal changes would alter their mood, but it also can contribute to the low self-image, low self-confidence, making you depressed, anxious about how you look. So there's academic stress. There's a pressure for students from their families, from their friends, from their schools to perform really well, especially in high school when you're going to be going to college soon. So they really put a lot of stress on themselves to do well. Um, as well as social networking. So social media, people are really having the chance to compare themselves to others, really, low self-image. There can be cyberbullying going on. And also a big one is exposure to pornography, which is, unfortunately such an issue. Contributes to the same things. Um, Also, negative thought patterns are pretty prevalent sometimes. Students maybe get into bad habits and then develop a negative worldview and lead to anxious feelings for the world and depression, like not excited to do things. And of course, socio-demographic factors, students who are LGBT, students who are people of color, students who have disabilities, um, are unable to really get the fullness out of school. They may feel like they don't belong. Here are some symptoms, generally students who aren't acting themselves, they're kind of recluse, they're not really concentrating in class, they don't really, raise their hand as much anymore. And also, how can we address anxiety and depression at schools and adolescents, Um, so number one is strengthen school cultures. So we're going to want to really build a community of schools and really kind of try to diversify and become inclusive, for all people to feel like they belong. And, also with that monitoring, students say and making sure that no one's getting bullied. Is for number two, we're gonna want to, expand SEL, emotional learning, and really start implementing that into school structures and even in classrooms. And then three, providing mental health support for students. So we're gonna really want to really nip it in the bud kind of thing, try and interventions and preventions. But even so, students are gonna have issues. So screenings, and you're gonna want to have treatments and resources for students to get, because more likely than not, they don't have access to that. And for four, we're gonna want to protect and prioritize high-risk students, the students who are, like I mentioned before, high risk, like students with disabilities, students who are in poverty, students who are LGBT, who have, sexualities are not, the norm, and people feel so out of place. So what can we do for students as teachers? Some great things we can do is try to keep our best relationship with students, really try to get to know them, really try to make them feel like we are there for them. And in that same vein, kind of offer a support and encouragement, because we want our students to feel motivated, that we're actually there for them, that we want them to succeed. Um, we also want to allow for accommodation and adjustments in assignments. So maybe something's going on at home and they can't finish their assignment. Just give them the day or two or the week or the month even, to really finish something, because you never know. Obviously, we need to communicate, but number four is implement mindful practices in classrooms. So really in classrooms, offering a time to de-stress and to really reflect and just to calm down from the, rambunctiousness of everyday school life. And number five is to really like seek out professional advice. There's resources for you. There's school psychologists, school counselors, social workers who can really help you, um, especially with your own school, like procedures and everything. So yeah, thank you. These are my references. So thank you for watching.